I'm really excited for this interview here as I will be chatting with Dr. Ellie Campbell as we're going to be talking about blood pressure. And so let me go ahead and dive into her impressive bio. And then, yeah, you're going to learn a lot of great things about blood pressure. And we're going to talk a little bit about her wonderful book. And so Dr. Campbell is a native Chicagoan and graduate of the University of Illinois, the Kirksville College of Osteopathic Medicine, and the Medical College of Georgia. Board certified in family medicine for 30 years, she also holds certification from the American Board of Integrative Medicine. She is a solo physician with specialty interest in interdisciplinary collaboration, functional medicine, reversing chronic disease, cardiovascular disease prevention, natural treatments for high blood pressure, and the many oral systemic connections. She also enjoys live theater, gardening, healthy cooking, hiking, travel, and playtime with her husband and 3 adult daughters. And thank you so much, Dr. Campbell. Great to have you here.
Thanks, Dr. Eric. It's my pleasure to be here today.
Yeah, I just finished reading your book, and it's just really a amazing wealth of information. Just really enjoyed. I mean, I didn't. I guess there's a lot of topics that you could write books on that you, and blood pressure is one of those things where a lot of people just think it's basic, just high blood pressure, high low blood pressure, and I mean obviously there's a lot more than the medications, which you'll talk about. But yeah, really interesting, and some of the topics I wouldn't have guessed would have been in the book. So just like oral health and things. So again, very excited to talk to you about this. And I know I gave a little bit of your background with the bio, but if you could dive a little bit deeper, like what led you to write the book?
Yeah, thanks. Thanks for the intro. So, I've been a family physician for 30 years, and one of my greatest joys is taking care of multiple generations in the same family. And when Cheryl came to see me, she originally wanted to have a baby. She was 42 years old and she'd had one child, but she wanted to have another. She was a little bit old to be pursuing this, but she went to fertility doctors and they told her that her and her husband's genes were incompatible with each other and they could never have a baby. And she said, well, that doesn't make any sense to me because I have a perfectly healthy kid. So we did it once, we can do it again. So make a long story short, I worked with her using a functional medicine approach to her fertility, and we were able to have her get successfully pregnant and have another beautiful baby boy. At the end of that, she said, you're pretty good with hormones here. I think my mother could help you, could use some help from you as well. So now I'm taking care of the 2 boys, the daughter, and now the grandmother. And the grandmother comes to see me. She has high blood pressure, and we take care of that with medication and therapeutic lifestyle changes. She has high cholesterol. I have her on medicine for that. And now she wants some bioidentical hormone replacement therapy so that she can keep up with her much younger boyfriend and go line dancing and drive the 4-wheelers and play with the grandkids and do all the things that this really spunky, wonderful grandmother did. And so we did all those things, and I was managing her care, standard of care, the way everybody in the community does. And one day Cheryl called me devastated. She was crying and she said, mother, she called her, mother did not show up to work today. And I went to her house. I peeked in every door and every window and discovered her crumpled on the floor next to her computer. She'd had a massive stroke and she was paralyzed on one side. And I felt devastated because I'm the primary care doctor. It's my job to take care of her, and strokes are supposed to be preventable. We knew she had risk factors, but I thought we were managing them, and she had an event anyhow. I felt somehow like my system had failed me. She joked with me that she was going into rehab and it was going to take a lot of therapy to help her start dancing again because dragging one paralyzed leg behind her was really challenging. Well, about 5 days into her hospitalization, she had an unexpected but not that rare complication. It happens in about 10 to 20% of strokes. That weakened blood vessel that had had the stroke burst, and Dee had a brain hemorrhage and she died. And I felt like I had been punched in the gut because it was my responsibility to take care of this lady, and we failed her. The system failed her. So I spent the next 3 years of my career studying everything I could about high blood pressure, high cholesterol, and stroke prevention. And I finally feel like I cracked the code on it. And once I did that, I felt compelled to write this book, not only to help myself, but all the other patients that I provide care for. And more importantly, to reach a larger audience, because there's so many DIY things that people can do to get their blood pressure under control, their cholesterol under control, and reduce their risk for cardiovascular events, which are the number one killer in our country. So I was going to write a book that I'll spoiler alert, the number one hidden risk factor to the number one killer in our country. And the problem that Dee had that I missed was a dental infection. It was a deep-seated dental abscess. And once I learned that, I wanted to write a book. I wanted to write a book about how oral health can change your entire life. And if you take better care of your mouth, you'll take better care of your brain, you'll take better care of your heart, you'll take better care of your kidneys, you take better care of your gut. You can't have a healthy mouth and have a healthy body. So I wrote this book about oral systemic connections, and nobody wanted it. I pitched it to 82 publishers, and nobody would publish this book. It was really boring. And so I fast forward, I Googled, this was right before the pandemic, I Googled what were the health topics that people were really interested in. And blood pressure came up to be the number one thing that people wanted to know about. In the top 10 years in a row, people wanted to know about blood pressure. And I thought, well, that's indirectly connected to my message. So I'm just going to flip it around. I'm going to make it my message and teach people what they really need to know, which is they need to eat clean food and drink clean water and exercise and reduce stress and get good sleep and have good oral health. And if we get that message across, we're going to save so many lives. So I'm so grateful for you, because those same fundamentals correct almost every chronic illness, from hyperthyroid to hypothyroid to diabetes to obesity. If we get those fundamentals right, we can reduce the risk of every chronic disease and dramatically reduce our risk of the number one killer in our country.
Yeah, I agree. Oral health is important, even though, again, I was surprised that you brought it up. I shouldn't be, because I talk about every now and then the importance of oral health. I interviewed my biological dentist, Dr. Ellie Campbell, on the podcast. So definitely agree that having whether it's even simply gingivitis, inflammation of the gums, but as you mentioned, like an abscess, an infection. I mean, of course, there's mercury amalgams that a lot of people have. So just there's a lot of issues we could have when it comes to the mouth. And again, most people think it just stays in the mouth, but it definitely doesn't. And
it definitely doesn't. I mean, we know that oxidative stress and inflammation are probably at the root of most chronic illnesses. And oral health is a primary driver of oxidative stress and inflammation. And beyond that, these little mouth bacteria that we now know, we're supposed to have bacteria in us, right? We're a microbiome having a human experience. We need to have these microbiome. We use their genes to do all of our metabolic processes. So we have to have healthy microbiome. But when we get unhealthy and we have a pathogenic burden, these pathogens do nasty things to us by driving inflammation. And there's one in particular I'd like to mention. It has a long name called Porphyromonas gingivalis. We call it PG for short. And this particular bacteria lives off of blood. So when it gets into your gums as a pathogen, it makes a really bloody gum inflammation, so that when you floss your teeth or you brush, you get pink in the sink. PG is often present when you have that gingivitis or periodontal disease. It makes that bloody mess so that it has fuel for its own self to live. Well, now it's really tricky. That PG bacteria buries itself inside the red blood cell, and now it becomes a hitchhiker. Now, wherever in your body red blood cells go, which is everywhere, the Porphyromonas gingivalis can hitch a ride and land wherever that blood cell lands. Once it gets there, it secretes a little fatty molecule called phosphorylated dihydroceramide. It's a wax, it's a plaque It makes plaque in your teeth, but if that blood cell lands in your brain, it can make plaque in your brain, and that can lead to dementia and Alzheimer's disease. If that Porphyromonas gingivalis bacteria lands in your neck artery, it can cause hardening of the arteries, carotid artery atherosclerosis. That leads to increased stroke risk. If that bacteria lands in the coronary arteries and makes phosphorylated dihydroceramide in that intima media space, it makes plaque in your coronaries, increasing your risk for a heart attack. And where did that bacteria come from? Your mouth. So I can't have my patients have a healthy brain or a healthy heart if their dentist and hygienist aren't helping me to make their mouth healthy as well.
Yeah, thank you for sharing that. So you of course recommend regular checkups. Do you recommend for someone to see like a holistic biological dentist, or does it, or just as long as they're getting regular
Absolutely.
checkups? Okay.
I think that first of all, a dentist who is not holistic is generally not educated in the fact that the mouth affects the rest of the body. They're focusing on this part and they don't really think about all the other connections. Furthermore, I have blood tests that I do as part of my routine cardiovascular prevention that I didn't know about this when I was working with Dee way back 8 years ago, but I know this now. And I do something called a fire panel, and it includes markers of oxidative stress and inflammation. And one of them is called LPPLA2. That stands for lipoprotein associated phospholipase A2. It's an enzyme, and it's made by white blood cells. And when those white blood cells are in plaque in the arteries, and that plaque is inflamed, and those white blood cells are angry, LPPLA2 levels go up. Well, it turns out LPPLA2 is also found in white blood cells in gum tissue. So I have a leading indicator in my cardiovascular blood work that tells me, Mrs. Dentist, Mr. Dentist, I have a patient that I need to send to you because I did their heart blood work and they have a clue that they have a dental problem. So if you're not using a biological or holistic dentist, they may not be educated and you'll take them these blood work and they won't know what to do with it. So you need not only a holistic dentist, but you need one who's been educated in what these markers mean, what they need to look for, and most importantly, how to correct the problems once they found them. Because we know that these mouth bacteria that cause this inflammation and lead to the plaque and lead to the oxidative stress that lead to increased risk are not easy to get rid of. Of course, it requires good home hygiene. You have to be brushing your teeth and flossing and rinsing, but not with the wrong mouthwashes, because the wrong mouthwashes will decimate the good bacteria, actually raising your blood pressure. So we got to be careful about that. But good home hygiene, and then a really good dental cleaning, often scaling and planing, deep cleaning. But those unfriendly bacteria, they're coming back in 4 hours unless you've done something to change the terrain. So we have to work with our biological dentists to talk about nutrition and pH and saliva flow and oral probiotics that are specifically targeted to help shift the balance of the unfriendly bacteria and chase them away and let the friendly bacteria that are supposed to live in our mouth flourish. And that requires a complex, personalized, precision, individual medical dental care team working together.
So I want to discuss some other factors that can affect blood pressure. But before we do that, can we go over some of the basics, like what's considered to be normal versus optimal, how to measure blood pressure?
Yeah, because that's different. When I was in medical school, we were giving people a buy 160 over 100 if they were over 70. You're old, you have high blood pressure, it's normal. Well, just because it's common doesn't mean it's normal, and doesn't mean it's healthy, and doesn't mean you're not going to have risks associated with that. So we now have determined that a normal blood pressure reading, believe this or not, is 119 over 79 or lower. That's a normal blood pressure. Even 120 to 129 over 80 is considered elevated. In the old days, we used to call that pre-hypertension, but they took that diagnosis away, and now we just call it elevated blood pressure. And the new guideline for hypertension, you are officially diagnosed with hypertension at 130/80 to 139/89. That's stage 1 hypertension. If it's 140/90 or higher, which was our old definition, that's now considered stage 2 hypertension and a much higher health risk for the development of heart attack, stroke, kidney failure, blindness, erectile dysfunction, and all of the other downstream organ damage that results from the pressure caused on those blood vessels from the hypertension. So recapping, we want our blood pressure to be less than 120/80. And if we're more than 140/90, we probably need to be under the care of a medical provider to get that targeted and under control. Certainly, many things are DIY. There are so many things that people can do to get their blood pressure under control. First, we have to know how to measure it properly, and I was doing it wrong for years. So we have now guidelines that tell us what's proper to measure your blood pressure. And the first and most important thing is you're not supposed to eat, drink, vape, or smoke 30 minutes before you go in to get your blood pressure checked. If you do that, the temperature changes, the caffeine, the physiologic processes of running digestion can alter your blood pressure. And we're trying to standardize it so that everybody has the same guidelines, and we're comparing A to B to C to measure blood pressure. So first, no eating or drinking. Next, we have to make sure that the blood pressure is the proper size and it goes directly on your bare arm. You should not put your blood pressure cuff over clothing, especially not over a sweater. But even a t-shirt can affect your blood pressure 5 or 10 points, and a sweater can affect your blood pressure 30 points and give you a false hypertension reading when all you really have is sweater pressure and you don't really have hypertension. The next thing, and this is a mistake that we made in my office for decades because I wasn't smart enough to know better, and the CDC hadn't published their guidelines until about 2019, is that you have to have an empty bladder when you check your blood pressure. Your bladder has very sensitive pain receptors, and when it stretches, it stimulates those receptors and it can raise your blood pressure. A painfully enlarged bladder can raise your blood pressure for 3 hours after you check it. So in my old days, we used to have the patients come into the waiting room. We'd have them sit down. When they were ready to go back, we'd put them in the exam room, sit them down, take their history, check their blood pressure, and then send them to the bathroom to get a urine specimen. We don't do it that way anymore. They come into the waiting room and they're escorted to the bathroom first thing, and they empty their bladder before anything else is done because we want them to have an empty bladder. It is a very important part of measuring your blood pressure, and most offices, including myself, don't do it properly. The next thing, once we fitted your blood pressure for the proper cuff, we want to make sure that your arm is resting at heart level. They're not holding it up. They're not dangling it down, that it's resting on usually an armrest at heart level. You're not allowed to talk. You're not even allowed to listen intently for 5 minutes. So in our office, we always used to chit chat. How are you today? How are the kids? How are the dogs? How's things going? Hold on 1 second. And then we tell them be quiet to take their blood pressure. Well, that chit chat can raise your blood pressure 10 points. Even intently listening to that really interesting conversation that's happening in the medical office next to you, that can raise your blood pressure 5 or 10 points. So no talking, no chit chatting, no active listening while you're trying to get your blood pressure checked. The next thing is that you have to be seated properly with your bottom to the bottom and back to the back and feet on the floor of the chair. If you are using your back muscles to hold yourself up, you can raise your blood pressure 15 points. If your feet are dangling, like you're sitting on the edge of an exam table, you can raise your blood pressure 10 points by dangling your feet. And I have a secret. I'm vertically impaired. I'm only 5 feet tall. I cannot sit in 90% of chairs with my bottom to the bottom and my back to the back and have my feet touch the floor at the same time. If your patients are vertically impaired like me and you want to measure an accurate blood pressure, you need to offer them a footstool to rest their feet so their feet are not dangling, because dangling feet can raise your blood pressure. Never check a blood pressure on an exam table. Or if you're a dentist and you're one of the wonderful dentists who's checking blood pressure in the dental office, the patient can't be lying supine in the dental chair to check their blood pressure. That's also not an appropriate way to do it. So we did lots of things wrong when I was measuring blood pressure. And now that we've standardized it and we follow these guidelines, we get much better reliable data. We also want our patients to check their blood pressures at home and to do those same things at home so that they too can get proper blood pressure readings.
Yeah, it's kind of scary that there might be then some people on medication who are falsely diagnosed with blood pressure if they were doing multiple things wrong, if they didn't empty their bladder, if the doctor didn't have them test with the bare arm and maybe they were wearing a sweater or maybe even a t-shirt, and if they weren't resting for 4 or 5 minutes, if they just sat down right away, had their blood pressure taken. So if they had 3 or 4 of these variables, maybe normally they would have had a blood pressure that's below, or maybe even if it's slightly below the 120/80, but then they read as like 140 over, and you know, you would assume that they wouldn't just give blood pressure medication just based on a single reading.
Right.
But if that's the way they measured every single time the patient came into the office and didn't have them do it on their own at home the proper way, then some people might be on medication when they don't need it.
You're exactly right. And we also know that there's a component of white coat hypertension. This is a very real phenomenon. There's something psychological, emotional that happens to people when they see the white coats or they see the doctor's office sign, and their blood pressure will go up much, much higher than it ever does at home. And those people deserve to have home blood pressure readings, just like we would never treat a diabetic based on a single reading of sugar that they get in our office. We should not really be treating hypertensive patients based on single readings we get in our office. We need a lot of data. We want home blood pressure data, or even a 24-hour ambulatory blood pressure monitor where they wear their same monitor 24 hours and every few minutes it gives a reading. That's kind of uncomfortable and hard to sleep with, so we can get a pretty decent reading with just frequent at home. Sometimes when you're stressed, sometimes when you're relaxed, when you've slept well, when you're sleep deprived. I want to see the whole gamut of blood pressure readings, because just like there's some people who have white coat hypertension, there are some people who have something called masked hypertension. And these are people who are really good at getting into their zen before they go to the doctor's office, and their blood pressure looks perfect. But when they get home and they have a spat with their spouse or they get in traffic, their blood pressure goes crazy high. And so the only way we would ever know this is if they're getting home data. And that's a message that I want to bring to the audience, is that for anybody whose readings are not routinely 120/80 or less, that they have a home blood pressure monitor and that they start checking some data at home and get it all different times and just keep track of it. You don't have to check every day. You don't have to check every hour, but you have to check some and keep the data going.
How accurate are other devices like there are wrist cuffs compared to arm cuffs?
Yeah, so far we don't think they're really ready for prime time. They don't seem to correlate quite as well. I think they're getting better as our technology gets better. Right now, at this moment in time, I absolutely do not trust a phone app or a finger app. The wrists, maybe if you're holding it properly against your heart at heart level with your arm resting, maybe the wrist ones are getting closer, but I still think the gold standard is an arm cuff.
And then other causes of blood pressure. So, I mean, one that gets a bad rap and has for a long time, salt.
Yeah.
So if you could talk a little bit about that.
There are some people who are salt sensitive. This is true, but it's not the majority of hypertensive patients. Furthermore, it's been my clinical experience, and probably yours as well, that people who are nutrient deficient, especially magnesium, potassium, manganese, iodine, these people who are deficient in those nutrients are much more salt sensitive, and they eat a normal amount of salt and their blood pressure goes up. But when we replete those micronutrients, now they can handle salt and it's not such a problem anymore. So I think every patient who's been newly diagnosed hypertensive or who has long-standing hypertension deserves a trial to see if they're salt sensitive, to go 2 weeks, very low salt diet, less than 2 grams, less than 2,000 milligrams. That pretty much means you can't eat anything from a box, you can't eat anything from a can, you can't eat anything from a restaurant for 2 weeks. You're cooking all your food at home and it's pretty bland. Unless you use lots of spices. You can use turmeric, and you can use Indian spices, and you can use Mexican spices, and you can use Asian spices of all types. You just can't use salt. And check your blood pressure for 2 weeks with low salt. And then go heavy on the salt and enjoy everything that you like and eat all the crazy salty stuff that you want and see what your blood pressure looks like. And if you're one of those people that has a 30-point differential between the no salt and the high salt diet, you probably are salt sensitive. But make sure you get yourself on magnesium and potassium and manganese and trace minerals and zinc and iodine. Make sure all those things are replete first, because then you can tolerate your little bit of salt, most likely with no problem. I think also most people who are salt sensitive are using the wrong salt. Just like we never in integrative medicine recommend that people eat foods made with white flour or white sugar. We want unrefined, natural whole grains and unrefined sweeteners. We don't want refined salt in a blue can that pours when it rains. That salt is highly refined, and sometimes they add iodine back into it, sometimes they don't, but it's highly refined. Let's use natural salt, full of minerals. It's usually pink, or it's gray, it's Celtic, or it's Mediterranean. And those salts are often much better tolerated than the refined white salt in the blue box.
Definitely agree. That's what I use. I use the more natural salts, either Celtic sea salt or pink Himalayan salts. So I'm glad you mentioned that. How about thyroid? Because a lot of the audience pretty much is thyroid, and some might think, well, if someone has low thyroid hormone, they're probably going to be more likely to have low blood pressure and not high blood pressure, and maybe vice versa if they have hyperthyroidism. And again, I can't say I see that in my practice. I mean, there's definitely people with hypothyroidism, Hashimoto's, with high blood pressure, and people with hyperthyroidism that have either normal blood pressure or low blood pressure. And I'm sure you see the same in your practice.
I do. I think they overlap a lot. And I also think that probably there's more correlation between the underlying root causes, right? So what is an underlying root cause of hypothyroidism? For many people, it's nutritional, right? Or it's environmental, or it's toxic. And so if we're living in a toxic soup, then our blood pressure is likely to be high, and we might have high hyper or hypothyroid in that instance. So we want to work on a lifestyle of detoxification. We want to work on a lifestyle that doesn't bring toxicants into our body. That means looking at our home environment. What are our cleaning products? What are our personal care products? What are our foods? How are they prepared? And when we lower our toxic burden, our blood pressure is easier to control. When we have heavy metals, that's probably something that's common. Often in heavy metal toxicity, you'll see thyroid dysfunction. And so I've seen hyperthyroid, I've seen hypothyroid from heavy metal toxicity. We work on chelating those metals one way or another, whether that's oral, rectal, IV, however we're going to get these heavy metals out of the body. As we do that, the arteries get softer, the blood pressure is easier to control. So I think that the same underlying root causes for one condition can drive the other.
And then any other causes of, like any direct causes or again, indirect causes of high blood pressure?
Yeah, I would say that certainly we've talked about the mouth, and we know, like in Dee's case, what caused her blood pressure to spike and caused her stroke was that she had a dental abscess. She actually had an appointment to have her tooth extracted a week after her stroke that killed her. So she never made it. She never lived long enough to have that event. I know that if the dentist knew what a medical emergency this was and how it was driving her oxidative stress, we would have been on either stronger antibiotics or done the procedure sooner. We would have intervened in some way, but neither of us were smart enough at that time in our careers to make that call. So now I'm smarter. And now when I see people with dental abscesses, it's like a 911 dental emergency. We got to get you on anti-inflammatories. We want to make sure you're taking a little baby aspirin. Right? We want to do all these things to get you prepared. But one of the probably number two root cause that I've seen since I've been paying attention, and it's also oral related, is sleep apnea. Many people have undiagnosed sleep apnea. I used to think I could look and tell, like, oh, that person's morbidly obese. They have a size 17 neck or 18 neck. They got this Jabba the Hutt body composition. Oh, that person's got sleep apnea. And often they do, but not always. Some people, very slender, very tall, very athletically fit, have horrible sleep apnea. One of my patients came to see me after his heart attack. He's a very strong, very fit triathlete. He had undiagnosed sleep apnea. He had undiagnosed familial hyperlipidemia. He had undiagnosed insulin resistance. So we got to all those root causes to try to make sure that he never has another event. But sleep apnea was a major contributor. His oxygen levels were dropping in the middle of the night down into the 80s. And when that happens, one of the things that your body does, besides waking you up at night to try to get some deep breaths to pull your oxygen level back up, is that's a physiologic stressor, and it raises your cortisol. So if you ever do a cortisol test and you have your morning cortisol nailed to the ceiling and you have these very high AM cortisols, that's an important clue to me that you're likely being woken up in the middle of the night by something. And that something is commonly undiagnosed sleep apnea. Most people with sleep apnea have obstructive sleep apnea. There's an obstruction in their airway, either their nasal airway, their nasal passages are clogged, their oropharyngeal airway, their adenoids are too big, their uvula is too large, their palate is too soft, their tonsils are too large, or it could be down farther in the oropharynx. In my case, when I was a teenager, they pulled 4 teeth out. I had an overbite, and they put me in headgear to pull my overbite back and make my teeth straight. That was lovely, except for a problem. By taking out 4 teeth, they narrowed my airway 15 millimeters. Now I had no room for my tongue except to stick it in the back of my throat. So every time when I lay down at bed at night, not only would I snore, I choked off my airway. And I developed sleep apnea as I got older. So developed a horrible snoring habit, which I didn't know that I had, but I found out when I spent the night with my sisters on vacation that I snored really badly. When I asked my husband about it, he said, yeah, you've been snoring for years. I said, why didn't you tell me? He said, I thought you knew. So this is something we need to have a conversation with our partners about. Do I snore? Do you snore? Let's find out. And if you snore, get a sleep test. Not all snorers have sleep apnea, and not all sleep apnea patients snore. If you wake up unrefreshed, you need a sleep test. If you have ADHD, you need a sleep test. If you wet the bed or your child wets the bed after around age 5, you need to get a sleep test, because these are often symptoms of not getting deep restorative sleep. And one of the reasons is sleep apnea. Some people have an upper airway condition and they just need nose surgery and their sleep apnea is cured. Some people need more than that. Some people do need CPAP, but I don't like to use CPAP as my first treatment of choice. I have about 5 other things I do before we ever talk about CPAP, except in the most severe cases. So sleep apnea, I would say, is a very common, very, very common and underdiagnosed trigger for hypertension.
So you said you're not against CPAP. It's just not, you try like 4 or 5 other things prior. And if someone has to be on a CPAP, do you look at it as temporary, just for a period of a few months?
When CPAP was first invented, it was intended to be a temporary bridge until we fixed their underlying root cause problem. And so I would like to believe that most patients with CPAP, sometimes we put patients on CPAP, they get deep restorative sleep and they lose 25 or 30 pounds without trying. Because for the first time in their life, they're not making high cortisol, they don't have the steroid burden, they're getting deep restorative sleep, everything calms down, they're not trying to keep themselves awake all day by eating extra calories or caffeine, driving their metabolic dysfunction. insulin resistance, et cetera. So sometimes CPAP makes them lose weight. They lose weight, their sleep apnea goes away. So sometimes, yes, 6 to 12 months on CPAP and they're cured. They don't need it anymore. It doesn't happen as often as I like it to, but it can happen. Often when I see somebody with sleep apnea who needs CPAP, I get them to see an oromyofunctional therapist. OMT is kind of like physical therapy for the lips, jaw, and tongue. And sometimes we can strengthen the soft palate. We can strengthen the lips and jaw. We can get that jaw pulled slightly forward just by retraining. And those patients now don't need the CPAP the way that they used to. In some cases, however, there can be a curative surgical procedure. For somebody like me who had 4 teeth pulled and they changed the shape of my jaw growing up, I was fortunately able to correct this wearing an oral device. It's called a Vivos device. They put in the roof of my mouth and in my bottom jaw. It had a little key. And I was advancing the key, a couple of turns every couple of nights and spreading out my jaw painlessly, I might add, my upper jaw and my lower jaw over about 2 years' time. I was able to expand my jaw and get back most of that 15 millimeters that I'd lost when they pulled my teeth out. Then I have to wear Invisalign to close up the spaces in my teeth that they made by widening my jaw. But now I have straighter teeth again and no snoring and no sleep apnea. So for me, that was curative. If I had more moderate or severe sleep apnea, I might be on a CPAP while simultaneously wearing the oral device. And the final thing is pretty drastic, but it's curative in 90% of cases of sleep apnea. And it's paid for by every insurance, but most people don't know about it. It's called a maxillary mandibular advancement surgery, and it's a big deal. It's a really big deal. They cut your jaw in half on the top. They cut your jaw in half on the bottom. They push everything forward. They do bone grafts and make extra room so that your entire face moves forward, and now your tongue and jaw move forward and get out of your airway. So is that my first choice or my second or my third? Not really, but I would rather you had cured permanently your sleep apnea and not required to go to Tahiti with the CPAP suitcase than suffer from any consequences of sleep apnea. And if we can permanently cure it and a surgery is the way to do it, it's on the consideration table.
Yeah, I mean, it's many cases a last resort, but there's a time and place, just like with thyroid surgery. I'm not a proponent of just, I mean, it depends on the situation.
Cancer. Right. But sometimes they need it. Yeah.
Yeah, exactly.
And I think that a really important point that's often not emphasized is the preventive nature. If we go back 1,000, 2,000, 10,000 years, we ate really gnarly food. Right? We had to rip the meat off our bones. We hadn't invented knives and forks yet. We were using our hands and our teeth to eat root tubers and strip the leaves off plants to get to the soft bark and the nutrients underneath. Well, that mastication, that chewing, that gnawing caused our cheek and jaw muscles to be really well developed. And we had really broad faces and broad jaws. And we did really well from a perspective of not having a small, narrow airway that caused crooked teeth and obstructive airway disease. Well, fast forward today, what do we give our kids to eat? We don't let them use a breast too often. We have them bottle fed so they don't develop strong jaw muscles. And then we give them baby food that's already been pre-chewed. So the babies do not develop the jaw muscles and don't grow their jaws the way that we need to. So pediatricians, I think, have a responsibility now to talk to our bottle-fed babies about jaw exercises, about giving their kids specific pacifiers, something called a myo-munchie, for example, that works those jaw muscles, that gets them to use those muscles so that these kids can grow. We want to talk about an airway assessment before age 5 and make sure that the kid doesn't have a tongue tie, they don't have a lip tie, that if a baby is not a good nurser, it's probably not the mom's fault. It's not that she's not good at this. It's that the baby has a physiologic restriction because they were either B vitamin deficient during their pregnancy or whatever, that they have this tether of tissue that's preventing the baby from getting their tongue in the right position. The proper position of the tongue resting is not how it looks in our anatomy books, which is on the floor of our mouth. The proper position of the tongue is resting on the roof of the mouth when we're talking, when we're sitting at rest or sleeping. And so if a kid or an adult can't get the tongue on the roof of their mouth, they got a problem. And that can lead to sleep apnea, which can lead to hypertension. And if we knew about it before the age of 5, they wouldn't ever need braces. Their jaws would be big. Their airways would be large. They would never have an airway problem. They'd likely not develop hypertension. We could prevent a whole litany of health problems in adulthood by addressing it in the kids.
And this should be addressed or evaluated by a pediatrician over a dentist, or maybe both?
Well, ideally, it's a pediatric dentist and pediatrician working together, or a family physician and a pediatric dentist working together, or a general dentist or a general family physician who's particularly trained and educated in paying attention to this.
How about certain supplements? And I'm thinking about licorice root. How concerning is that if someone has, I know if they have high blood pressure, it's a concern. Is it a concern if someone has normal blood pressure?
Yeah, generally speaking, no. There's a component of glyceric acid that's in the licorice supplement itself. That's the problem. So if it's DGL, which is deglycerized licorice, most people can tolerate that with no effect on their blood pressure. And most of the supplement companies make that DGL. However, we do use licorice a lot. It's a great sweetener. It's an adaptogen. There's lots of advantages to licorice. Some people are very sensitive to it. And I've had one person develop profound edema, gained 30 pounds of fluid, and jacked up their blood pressure from taking a licorice supplement when we were treating something else. So you do have to respect it and be careful and know about it, but it's reversible if you stop the supplement and pay attention and change to something else. You can get usually no permanent problems from taking a short course of licorice.
And then most of the focus has been on hypertension. When is it a concern with hypotension, when blood pressure is too low?
Yeah, it's a concern when it causes symptoms. So many people run around with blood pressure of 90/40, and there's no symptoms whatsoever. Often these are petite little people, adults who are under 5 feet tall, under 100 pounds. They have a blood pressure of 90/40, and that's perfectly fine. They're getting perfectly good blood flow to their brain. They don't have any symptoms if they change positions. But if they get weak or dizzy when they stand up, that blood pressure is too low for them. And it's likely an indicator of a problem. That problem might be mitochondrial. That problem might be nutritional. That problem might be thyroid. That problem might be adrenal. So, or we're seeing a lot of this post-COVID. We've seen a lot of vascular damage from this, and this postural orthostatic tachycardia syndrome, POTS we call it, in post-COVID. So there's a lot that can be done to help those people. Retraining of their sympathetic, parasympathetic nervous system can be done. It's not easy to do, but it can be done. And often they're nutritionally not balanced either. So low blood pressure can be a problem when it causes symptoms. That being said, if you have chronic kidney disease and we're trying to not get you on dialysis, the lower the blood pressure, the better. It preserves the kidneys for a much longer period of time. So as long as you're not having symptoms and we keep your blood pressure low, that's what our goal is.
Yeah, because I tend to be on the lower side. So like sometimes it'll be like 100/60, for example, but I feel fine. So as long as symptom wise, I feel okay, I shouldn't worry about it.
I wouldn't worry about it. I would count yourself in the lucky box.
All right, good deal. So let's talk about some natural options. And of course, it comes down to addressing what you spoke about. So the oral health issues, we spoke a little bit about thyroid, and if someone's using the refined salts and not the natural salts. So, but I'll let you take over. So if someone is listening to this, what are some steps they can take to help with their high blood pressure?
Yeah, well, my experience, probably the number one most common missing nutrient in hypertensive patients is magnesium. So we have lots of different choices of magnesium out there. There's magnesium oxide, magnesium citrate, chelated magnesiums like magnesium glycinate, magnesium malate, magnesium threonate. So in general, for the most part, I don't like to use magnesium oxide. It's the cheapest one. It's available at every hospital pharmacy. It's available at every drugstore, but it's not very well absorbed and it doesn't get into the cells the same way that one that's chelated to an amino acid does. So I would switch somebody if they're on magnesium to a magnesium malate or magnesium malate glycinate combination. That's what I take myself every day. I take 3 capsules once a day. It's, every skeletal muscle cell requires calcium to make it contract and magnesium to make it relax. And that's including the little tiny muscles that are on the surface of our blood vessels. If they don't have magnesium to relax, they're going to be stuck in a constricted state. So magnesium is often super helpful as long as it's inside the cells and not in your bowels and being pooped out, like magnesium citrate tends to do, right? Magnesium citrate is a wonderful laxative, but not really great for your blood pressure. So that's why I like the malate or the malate glycinate combos. I take 3 every day. They don't make me sleepy. Some of my patients find they're so relaxing that they can't stay awake if they take them. I take mine in the morning. That's when I take my blood pressure or my magnesium. It also, as long as I take it daily, I have poop like a champ and I sleep like an angel. So magnesium is my miracle. If I'm stuck in a desert island and I can only bring one supplement, I'm bringing magnesium. So that's a simple one. Now, what if you really do have hypertension, but you don't want to go to a medical doctor and you don't want to take care of it that way? You're going to be very diligent about checking your blood pressure and keeping your target above 120/80 or maybe 130/80. If you have end organ diseases, if you have heart disease, if you have diabetes, if you have kidney disease, if you've had a stroke, if you've had a heart attack, you should probably really aim for those lower readings, 120/80. But if you've never had a problem, we can be a little softer with you. You can go up to 130/80 and not have to take anything for it as long as you've never had a problem. So what's one of the best things you can take? One of the biggest bang for your buck supplements is hibiscus. It's that pink flower that we see here in Georgia growing all over the place in the summertime. But if you make a tea and drink hibiscus tea, hot or cold, you can drink it hot tea. You can make sweet tea out of it. Everybody in Georgia drinks sweet tea. Recommend you sweeten it with xylitol, not sugar. Xylitol is a polyol, often made from birch bark. It also happens to be a prebiotic that supports oral health, and it also lowers your blood pressure just a little bit. So hibiscus tea, 3 servings a day, can lower your blood pressure 20 to 25 points. It's one of the biggest bang for our buck nutritional supplements. So I really do like hibiscus. There are many others. One of the common ones we think about is hawthorn. Both the berries and the root have antihypertensive properties. They also act a little bit like a beta blocker, so they tend to slow down a fast heart rate. So if you're one of those people who kind of tends to run that 90 to 100 blood pulse rate, as well as has high blood pressure, hawthorn berry might be a really good choice for you to kind of help get both things under control. We can think about, there's many other supplements that we can use. Ginger, for example, and cardamom, parsley. These all have antihypertensive therapies, and each one will typically lower your blood pressure somewhere around 2 to 5 points, except for hibiscus. Hibiscus is the big bang for our buck one. That's in the 20-point range. One thing I do want to mention is mouthwash. Traditional mouthwashes like Listerine that make that really napalm clean in your mouth have been shown to raise your blood pressure up to 5 to 7 points and persist for many hours after you use that mouthwash. Why would that be? How could that possibly affect something? Well, in the 1990s, there was a Nobel Prize awarded to 3 doctors for the discovery of a gaseous signaling molecule called nitric oxide. I like to call this the miracle mouth molecule because it has so many downstream effects. As they were trying to do this discovery and try to turn their nitric oxide discoveries into a commercially available pharmaceutical, they were trying to make a blood pressure medicine, because one of the things that nitric oxide does is it opens and dilates blood vessels, thereby lowering blood pressure, which is a nice thing. So they had this supplement, sildenafil was its name, and or drug they were trying to manufacture for blood pressure, and it wasn't working very well to lower the patient's blood pressure. They were getting real disappointed. But man after man after man in this clinical study was coming in going, guess what happened to me? I haven't been able to get an erection for years, and since I started taking your blood pressure medicine, I get a good erection in the morning. And so they discovered that this medication had nitric oxide benefits, mostly in the pelvic floor, much more so than in the peripheral arteries. So they turned it into Viagra, and it was based on this nitric oxide research. And so we now know that if we do the pathways a little bit differently and not try to trick Mother Nature and use Mother Nature's nitric oxide instead of the drug company's artificial one, we can get really big benefits. Nitric oxide is made in every cell in your body, but it's predominantly made by cells in the floor of your sinuses. And there's an enzyme that's made in your tongue and the crypts of your tongue by mouth bacteria, by friendly mouth bacteria. And this nitric oxide synthase is annihilated when you use mouthwash. So we want to use only mouthwashes that have been shown to not affect nitric oxide, and to make sure that we're supplementing with the things that drive nitric oxide pathway. That includes nitrite-containing vegetables. Beetroot and arugula are 2 of the biggest, most common ones, but leafy greens in general. And then supplements like Berkeley Life has one and N101 has one. They contain a little bit of B vitamins and some citrulline and beetroot extract, and they can be used to help our bodies make more nitric oxide. And as an aside, about 50% of Viagra non-responders, if they pre-treat with a nitric oxide lozenge like Berkeley Life or N101 and then take their Viagra works. So little tip and tidbit for controlling blood pressure, but also increasing nitric oxide, is to use these nitric oxide tablets. I recently had the blessing opportunity to go to Peru, and I was in Cusco at 12,000 feet, where altitude sickness is a major problem. In part, your oxygen level is lower and your cells don't carry oxygen as well. Well, nitric oxide will improve the oxygen carrying capacity. So I use those nitric oxide lozenges for myself to prevent my altitude sickness. I don't have any issues with blood pressure, but I didn't get altitude sickness when I used my nitric oxide support. So it's a nice little thing to have in your tool chest at home.
Interesting. I didn't know there were nitric oxide lozenges, so that's pretty interesting.
Yeah.
How about CoQ10? What impact can that have on blood pressure?
So certainly we know there's an age-related decline in coenzyme Q10 levels. This is one of our body's natural antioxidants, and there's different amounts in different organs in our body, and our heart is one of the ones that has the most rapid decline in CoQ10 levels as we age. So utilizing CoQ10 to get those levels up to 20-year-old or 30-year-old levels can really make a difference in the resiliency of our heart and can lower blood pressure as well. That's one of the, you get maybe 5 or 7 points of blood pressure lowering by supplementing with CoQ10. It also is heart protective. And we know that the same pathway, the HMG-CoA reductase pathway that turns mevalonic acid into cholesterol, that's the pathway that we block with statin drugs. That same pathway makes coenzyme Q10. So when we block the production of cholesterol using Lipitor or Crestor, we also block the production of coenzyme Q10, and a consequence can be high blood pressure of taking those medications. So supplementing with CoQ10 can reduce muscle aches and headaches and fatigue caused by lowering CoQ10, but can also improve blood pressure. So CoQ10 is another great supplement to include.
All right. Well, you shared a lot of amazing information. Really do appreciate it. Before we wrap up, is there anything else that I should have asked you that I didn't ask you, or any last words that you have?
Yeah, where can you get my book, The Blood Pressure Blueprint? It's on Amazon, on ebook and paperback, and it will be coming out in 2024 as an audiobook.
All right. Yeah, we were going to get that there. So where could people find out more about you? So, but yeah, definitely check out her book. And that's great that it's going to be on audiobook. I'm one that listens to audiobooks. Honestly, if it was on audiobook, I probably would have read it. But since right now, as of recording this, there's only the print edition, and definitely wanted to read it before our interview. So appreciate you sending me a copy. And yeah, very interesting. So highly recommend reading it, or when it's out on audiobook, listen to it, or do both. And also, can you remind people of your website and anywhere else people could find you?
Sure. So I see patients in Georgia. I am accepting new patients. I'm very proud to report that since I cracked the code on this root cause resolution approach to managing hypertension and cardiovascular risk reduction, we have had 0 heart attacks or strokes in any patient for 7 years. And so I am taking new patients, even if you've already had a heart attack or a stroke and you don't want to have another one, but you have to come to Georgia to see me. I can only see patients face-to-face, at least the first time. We can do remote visits after that. CampbellFamilyMedicine.com in suburban Atlanta. That's my practice. The website for the book is just getting started. There's not a whole lot of information other than there's links to all the podcasts that I've been on. If you think I tell interesting stories or you like what I talk about, there's a whole bunch of podcasts on the bpblueprint.com website. So those are the places you can find me. If you want me to come to your event and speak, Dr. Ellie Campbell speaker.com is another website where people can find me.
All right, wonderful. Well, I'll make sure to include the links in the show notes. And thank you so much, Dr. Ellie. Appreciate you taking the time to talk about blood pressure. Really, I'm sure the listeners learned a lot, and I learned a few things as well.
Well, thank you for having me. I appreciate it. We all work together. Everybody's got their little niche, and none of us can do everything. And no cardiovascular prevention program is complete without a medical doctor, a dentist, and a hygienist on the team. So we really have to work with interprofessional, interdisciplinary collaboration. And I guess another point, something I didn't mention is chiropractic adjustment. I've seen many people normalize their blood pressure once we get their spine and posture in alignment. So don't forget about that too.
Yeah, no, definitely glad you mentioned that, since my background is a chiropractor. And yeah, I agree that working as a team and not just relying on a single healthcare practitioner, because no one practitioner has all the answers. I mean, you have a lot of knowledge, I have a lot of knowledge, but
together we're better.
Exactly. All right. Well, awesome. Well, thank you again. This has really been a great conversation.
You're so welcome.
All right. And now, if anybody has questions, we do have some good comments here. So we have Jamira. I hope I pronounced your name right. If not, I apologize. But thank you. I learned so much stuff I didn't know. We got Brenda. Thank you. I learned a lot. All right. I'm glad for the comments. Any questions? If there are questions, now is the time. Dr. Ellie said she'll stick around for a few minutes. If there are no questions, that's fine. But if there are any blood pressure related questions, now you said you see patients, again, I'm sure most people are high blood pressure. Do you see low blood pressure cases too? If someone has hypotension?
Yeah, certainly. I see, especially post-COVID, we're seeing a lot more orthostatic hypotension, people with low blood pressure. When they try to stand up, their blood pressure falls out the bottom and they get weak and dizzy. So I'm seeing some of those, but much more like POTS. Yeah.
Okay.
Much more hypertension than low blood pressure in my patient population.
Yeah. Okay. All right. Yeah. So if anybody wants to, again, schedule an appointment as well, oh, here we go. Well, this is, so what's your practice called again?
It's called Campbell Family Medicine.
Campbell Family Medicine. That's easy enough. And when did you say the audiobook is, or when do you plan on having it out?
Fall of 24.
Okay. All right. So yeah, have you started recording yet or?
I'm using a service, and yes, we've got just getting started.
Okay. Okay. Yeah. I released, a new book and I did the recording myself and it's definitely time consuming doing
It
it on
is.
your own. But once it's done, it's nice. Anyway, it'll be nice having that option because you'll get a lot of people who prefer listening instead of reading.
Understood.
And, yeah. And
You're so
Shabira.
welcome. Thank you to your audience for spending time with us today. We're grateful for their attention and hope that they
Yeah.
see the message that you don't have to suffer heart attacks. Heart attacks are optional and strokes are stoppable. Dialysis is not your destiny. Getting your blood pressure under good control is important for all of those. And there's a lot of DIY stuff you can do. So get the book and spread the message.
Yep. Yep. I agree. Definitely get her book. And since there's no questions, we'll wish everybody a great rest of your Friday. Wonderful weekend ahead. And yeah, whenever you get a chance, yeah, I say don't wait for the audio book. Get it now. Since it's going to be a few months. Read it. You won't regret it. And you could always get the audio book later for reinforcement. Sometimes I do that too. I'll read something and I'll be like, you know what? It's always good. You always learn something else when you read something a few times or read something and listen to it. So yeah, check out Dr. Ellie's book. And again, thanks everyone. Take care. And again, have a great weekend ahead.